Thank you.
That sounds good. So yeah, Sandy, please feel free at any point just to ask me questions along the way. We don't have to wait until I'm completely done through this presentation. Just feel free to ask me any questions that you have, and that's kind of nice having, few people because we can just answer any questions for you. So again, my name is Jordon. I'm an occupational therapist and I'm part owner of Fusion Rehab and Wellness. So we are the therapy company that is provider for the BRC building, as well as Lavender Farms and Cherrywood Memory Care. And so really, I just wanted to take this time to talk about the benefits of therapy, the different types of therapy, each discipline, how each discipline can improve someone's quality of life. And then also specifically about Fusion and our partnership with Balfour, kind of what that looks like. So even though, your mom is at Longmont, there's a therapy company that is up in Longmont and Balfour. And so a lot of this will be very relevant. They have therapists up there. So just let me know if you have any questions along the way. Let me just go. So just briefly about Fusion. I mean, like I said, it's founded by myself and my partner, David. So I'm OT and he's a physical therapist, and we've basically been working specifically with the older adult population since 2015. That's where our passion has always been, is with working with older adults. And like I said, we service the Balfour, in particular, the Louisville campus. And we do PT, OT, and speech therapy. Our company was actually created specifically for Balfour. So we were not existent before. It was actually developed specifically to serve Balfour. And our company is very tailored to the needs of the residents of Balfour. And so we have a multi or an interdisciplinary approach because we have all three disciplines, which is really nice. And our mission is basically to improve the quality of life and achieve the highest level of function for those we serve through compassion and excellent patient care. Because David and I are clinicians first, that's why we went to school for all the years that we did, is because we're clinicians and we care. And so that's why we created Fusion, essentially. So patient care is our top priority because that's why we went into the fields that we chose. So the therapy services, I created this little diagram over here because truly occupational therapy, OT, physical therapy, PT, and speech therapy, we have a lot of the same common goals, but we have our own unique approaches and training and education behind each of our disciplines, which is why it's really great to have all three. So our common goals, of course, enhance the quality of life, slow the disease process, whether that's from a stroke or Parkinson's disease or simply just getting old, maximizing safety, helping determine the best living environment. That can be very challenging for everyone involved, the person, the family, the care team, loved ones, everyone. And so just having a therapy approach to help with that can be very beneficial. And then we work with family and residents through the continuum of care, especially for the Louisville campus, because they have a skilled nursing side and a assisted living side. So it's very common for people to go from one to the other. But of course, even if, in Longmont, someone went to the hospital and they're discharging back to their home in Longmont, just working through that. Okay, let me move on here. So let's talk a little bit about physical therapy, which is, I like to say, the easy one because you actually know what it is based off of its name. So it's really working with people to get them stronger. And also, I mean, if they have body aches and pains that can slow you down, I like to say, think of if you need physical therapy when you want to maximize independence and safety after you had a hospitalization or acute event that maybe set you back. But maybe you just want to maintain your current activities and maintain your strength and not have a decline. It's kind of keeping you at your maximized functional potential. So recent falls, that often prompts a referral. Pain, physical therapists are very skilled in pain management, and I'll touch on that a little bit later. Fear of falling. So, it's really important as a care team that we reduce falls. We talk about it all the time, keeping people nice and safe. But as a person and also as a therapist, we don't want people to be overly afraid of falling that they then become immobile. And so really therapy can help educate and really help the person know, are you safe to do X, Y, and Z? Because we don't want you just staying in your chair and being afraid of falling, because then you'll just decline. Weakness, dizziness, improper use of cane or walker. If you see people kind of furniture walking, that's probably a need for physical therapy and maybe occupational therapy. Muscle rigidity, difficulty with transfers. So physical therapy, it's very individualized. So kind of contrary to like a group exercise class, which are great. They're great. But physical therapy really does take the whole person into context and creates an individualized home exercise program specifically for that person with all of their potential and deficits in mind. It can help improve balance, stay stronger. Any questions so far?
Yes.
Okay. Occupational therapy. So, of course, this name, we know I'm not here to help you find a job. That's often kind of the response. I don't need a job. So really where that name comes from is we use meaningful activities, occupations, as therapy. And so it's actually doing the functional task and assessing the functional task to make sure that the person is actually safe, or using those as therapy. So OT, which I can just talk lots about, but it does overlap a lot with physical therapy in this current setting. There are definitely some differences for sure, but we do overlap. Like, our goal is to maximize the independence and safety, prevent further decline. We can help with pain. If there's pain with the dressing, can we do it a different way? I have a resident right now that she used to play the accordion, and she hasn't because she has shoulder pain. And so I assessed it during my session with her, and we came up with a modified technique. And those accordions are huge. And so it really did take some problem solving, but she looked at me and she was like, Jordon, I haven't played my accordion in years. And she didn't have any pain with it. And so really that was her meaningful occupation, was her accordion. So getting back to doing something that she loved to do. And I mean, it was awesome doing that with her. That's what I get most enjoyment out of. Difficulty feeding yourself, dressing yourself, bathing, like your self-care tasks. OTs were really skilled in offering different techniques and also different equipment, and making sure that you are safe when doing that, because those are things we do every day. We toilet every day, we dress every single day. So we want to make sure that those activities were as safe as we possibly can during them. Again, we have lots of individualized home exercise programs, so we take into consideration visual deficits or their sensory deficits, of course, their strength, their balance, proprioception, all of these things that we really tailor it to the individual. And then OTs, this is where OTs differ quite a bit from physical therapists, but we do cognitive assessments. And so deficits in cognition are often not as readily available as deficits with physical function, especially if there's just higher level cognitive issues going on. And so when you're talking about, is my mom or my dad safe to live in an independent living facility versus an assisted living or a skilled nursing facility? It's really important to take into consideration the cognitive piece of it. Because if a person can walk around and be physical and move around really well, that's great. But are they going to leave their oven on? Or, there's just so many things that cognition can impact that could make it no, they're not safe. Another piece here, driving assessments. I mean, so occupational therapy, there's a lot of times people just think it's the basics. It's the dressing, the bathing, the feeding, but we go all the way up to very complex tasks like driving. Driving is a very complex occupation. So when is it a time that you should consider not driving? Is it just based on a feel? Well, I would like to say probably not. There's more objective ways to have that conversation with someone. And when they look at you like, why should I not drive anymore? You're not just saying, well, I just think it's time. So we can be really skilled at addressing that occupation as well. Okay, the next one is speech therapy. So speech therapy also is known as speech language pathology. And a lot of times there is a little bit of a misconception because people think that speech is just the articulation, but it's also language, which is the cognitive piece as well. And so speech therapy really encompasses swallowing, if there's concerns with weight loss or there's a change in diet consistency. If someone becomes difficult to understand, maybe they have poor or low voice control, shortness of breath even can sometimes, like if it limits conversation, that can sometimes prompt a speech therapy referral. And then OT really overlaps with speech in this way that they also very much are skilled in addressing cognition. So memory issues, are they getting lost in familiar places, not recalling information, difficulty with managing their checkbook or medications. So their interventions, it can be cognitive therapy, strategies for remembering information, strengthening the muscles around that are responsible for swallowing. And then, like I had said with the OT, it can also be key for determining the optimal living situation. So that is a broad umbrella of the 3 disciplines. And then I'm just going to touch on what we specifically offer at Fusion Rehab and Wellness, because just like most health professions, you can specialize in certain different areas. And so for our therapists, the first one that I wanted to talk about is a Parkinson's treatment. And so I'm certified in LSVT BIG. That's what the program is called. And it is specific for Parkinson's disease. There is some research emerging for use in stroke. But right now, the research is very heavily in Parkinson's disease, and the outcomes can just be great. So basically LSVT, it trains improvement movements for activities, whether it's small things, like if you're buttoning, if you think of someone with Parkinson's and they have tremors, or large motor tasks like walking or transferring. It's really trying to focus on those big movements and getting outside of kind of the small movements that tend to happen very often with those with Parkinson's. So, Sandy, do you know anyone with Parkinson's? Does this interest you? I can talk more about it, but
it's interesting. 2 weeks ago, we lost two friends, and they both had Parkinson's. So I'm familiar with it, but it isn't
Okay.
something that is on mom's um, horizon yet.
Yeah.
But
Okay.
it is interesting that there are specialty treatments,
Yes.
and there had to be, yes, but
Yes. And I mean, it sounds like you're very familiar, like you know how debilitating this diagnosis can be.
yes,
And,
yes,
but people can live with this diagnosis for years and years and years, and oftentimes it's misdiagnosed. And so this particular program, it is an intensive program. If you do it as prescribed, it's 4 times a week for 4 weeks. A lot of times the patients that I see, maybe they're getting multiple disciplines and they're just not up for having OT 4 times a week and physical therapy too and speech too. But I also always just implement these things that I've learned with LSVT BIG into my sessions, and I do the exercises with them. So even if they can't tolerate or they don't even want to have that frequent of therapy, it's something that is just, it's very useful as a therapist to have these techniques when treating someone with Parkinson's.
mhm. Well, it's great to know that this is out there. You
Yeah.
you never know in the future, you know, when
That is true. And,
when that
since I've had this training as well, I mean, there's patients that I've seen that I'm like, my radar kind of goes off, and maybe it's just an arm swing that doesn't look right, something very subtle. And I'm like,
Mm,
they might need to go see a neurologist. And that's also why it's good to just have therapy eyes on the aging population, because we just offer, another perspective. But this does take extra training. So it has to be someone, that goes through getting the certification. You have to renew it every 2 years type of thing. So it is a specialty.
mhm.
The next one is, and my partner David, he's actually visiting his grandma this evening, but one of his specialties is trigger point dry needling. And so um, he told me that what he often says to people is dry needling uses a very thin, low profile needle. It's similar to what they use in acupuncture, and it goes into the muscle belly itself that's contributing to the painful area that the person is experiencing. Using the needle, maybe in combination with some e-stim, electrical stimulation, it can actually help relieve the trigger point and dysfunction of the muscle. And it allows the muscle to essentially reset and kind of relax. When you pair dry needling in combination with some specific exercises, it can really, really help with pain management. And so, again, this is something that it's extra training on top of your entry level degree. So it has to be performed by a physical therapist. And yeah, I've never received it personally, but I've heard really great outcomes, and it can really help with chronic pain, which is very prominent in the older adult population. So, um,
It
so
works.
yeah, it sounds like it did for Judy too.
Mhm.
So fall prevention, our therapists, we complete home safety evaluations and then environmental modifications as needed. So that, we go in and we look, how are they doing getting on and off the toilet or in and out of bed? Would they benefit from a toilet riser or some specific equipment? High level dynamic balance and gait training. So in order to decrease a fall risk, it's great to maximize your balance. And so a lot of times, in particular, physical therapists, they really hit this part hard. Again, we talked about like the individualized strength exercises, and then also like ADL retraining. And so for me, I kind of touched on that, but is there a different way that we can have you get dressed or toilet? We tailor make the fall prevention program to the person and their unique needs. Okay. Vital stim. So this is specifically speech therapists. They have extra training. And so our speech therapist does have a special certification to use this device. It's a non-invasive therapy that uses e-stim, an electrical current, to stimulate the muscles responsible for swallowing. So it just goes around this area. And it helps improve a person's ability to swallow, which is huge because it can impact their oral intake, their weight, maintaining their weight, preventing aspiration, especially after like a stroke, or if their muscles are just weak, then they have an increased risk for getting pneumonia. And so using this is a great way to strengthen those muscles. And it can also be used for someone who has Parkinson's, because those muscles are often affected as well. Prehabilitation. So this is basically just the theory that the stronger you are before surgery, the stronger you will be after. And so I can't tell you how many times I've seen a patient, they finally got their knee done, or they knew that they were going to need their back to be operated on, and they kind of put it off, but they finally had it. And I'm trying to tell them how to get their socks on while following their precautions, while not bending or breaking their spinal precautions. That time would actually be best utilized before they are out of the hospital, they're exhausted, they're in pain, and they can focus, they do as best as they can, but probably the better time is before that, when I have their undivided attention and they didn't just go through this major surgery. Even knees and hips, yeah, sure, it's routine, as in it happens a lot, but those are still major surgeries. And so if people know, I got to get my hip done, I got to get my knee done, get an evaluation from a PT and OT before that happens, for those reasons that I just described. And then also, just equipment. When I come in, I'm like, oh man, they're having such a hard time getting on and off the toilet, or they really need a socket or something. It'd be so good to have those pieces in place before the whirlwind of after being hospitalized. And then just being stronger. For every 1 day in the hospital, it takes about 4 days after of therapy to recoup. So if you were in the hospital for 2 days, you're going to take a good 8 days of therapy to get you back. And then it just is more and more. So let's get you as strong as we possibly can before you go to the hospital. And then aging in place. Of course, this is everyone's goal. Everyone wants to stay in their home. And so that our goals truly are your goals. That's the thing that's great about therapy, is that we want what you guys want. And even if we see something that we want to work on and we ask I'm just speaking for myself, and I ask the person and they're like, I don't care about that. I'm like, okay, then we don't work on it. We truly work on things that are important to the individual. And aging in place oftentimes is very important. So we work together with you and your family to make sure that any areas of concerns are discussed and a solution is made to keep you where you would like to be living. And sometimes, it can be more helpful from the perspective of a therapist. Hey mom, you need to remove your throw rug. That comes better from a therapist than maybe a family member, because we're kind of unbiased. So sometimes those home safety evaluations can just go a little bit better that way. And then we talked about this a little bit, but for those people who are still driving, but they're on the brink of, okay, you're seeing more dings, you're hearing some pretty precarious stories, but like that is such a hard topic to like approach, being a son or a daughter. It's hard as a therapist, but being a family member, that is really hard. And so I do off-road driving assessments for my patients, and it's basically a battery of assessments: physical, coordination, vision, cognition, all the sub skills that are needed that would indicate if someone is a safe driver. I test those, we look at it, and then we say, okay, is this safe? Are you on the borderline? And we kind of go from there. But it's useful for family members who are concerned if they're safe to drive or not. I have treated an individual who she hit a biker, and that was the reason that she stopped driving. So the point is, we want to start that conversation before something like that happens. And it is such a valued occupation. So it's a big deal. And if they are safe to drive, then maintain that, because that is, it's huge. So I just wanted to share this recent study that came out. So it was 1.4 million Medicare cases, a study, and it indicated that patients receiving physical therapy and occupational therapy have a better quality of life and fewer hospital readmissions. So it was a first of its kind study. And, insurance is always looking for ways to like deny coverage of things. So for this to come from Medicare, it's a pretty big deal. I mean, obviously I'm biased because I'm a therapist, but if you can take it from an insurance company, I think it's pretty valid.
Wow.
So I think the big takeaway on this is that PT and OT, we have a direct and positive impact on patients in post-acute care settings, which are assisted livings and skilled nursing facilities and independent livings when they go home. Improves the functional ability of patients and reduces going back to the hospital. So, all right. And then collaboration with Balfour. So what does this look like for our company in particular? So Fusion attends daily and weekly care team meetings. I mean, I already kind of touched on the fact that our company was literally founded around Balfour. So we are tailor-made. When Balfour comes to us and says, hey, Jordon, do you think you'd want to do an educational series and talk about the benefits of therapy? My answer is yes, because I know that helps Balfour, and it also it just goes in with that partnership. We've also done transfer training education for the staff there. And we have care collaboration with the Sky Health medical team, which is like their contracted physician group. So all of us, Balfour staff, the nursing staff, the therapy, and the physician group, we are constantly talking. So our office is in Balfour. We're not off site and just have a few therapists there. We are there, David and I, the owners of the company, we are there, we're in it, and we are wanting to make this the best product for Balfour residents. Communication with the Balfour team to ensure smooth transitions across the campus community. And so even Sandy, like for you, your mom moved from Louisville to Longmont. And so likewise, on the Louisville campus, going from like the skilled nursing to the assisted living or back and forth, those changes are big changes for someone. Transitioning where you're living, it's a big deal. And so therapy, we want to make sure that we are there bridging that for the resident as they go through this big change, and also being a support system for the family as they have to decide, what's best for my mom and dad?
Mhm.
I don't know. Let me just get another perspective. How are they doing in therapy?
Mhm.
Okay, let's see. Almost, oh, we are done. So, questions for me about anything from any of you lovely ladies?
Well, Mom didn't move from Louisville. I,
Oh,
I didn't mean to say that. It was my mother-in-law who was
oh,
at Louisville,
your
but
mother-in-law.
but my mother-in-law, but Mom moved from independent living, I mean, in her own home.
Mhm.
Okay.
She has chronic back pain,
Mm.
Mhm.
and so when I had her to an orthopedic specialist, he took all of the pictures and said, you know, that he would suggest, therapy.
Mm.
There wasn't anything surgical,
Mhm.
to do. And we were going to start that about a year and a year ago. And then the glaucoma took
Mm.
priority, the
Mhm.
eyes,
Yep.
and she had to have some eye surgery. So we
Mm.
haven't gotten back to addressing um, therapy, physical therapy.
Mhm.
But I know when she moved in to Longmont, Callaway said there is a partner with the Longmont
Mhm.
Mhm.
facility. And why didn't they move you or expand you to Longmont?
Yeah.
I don't understand.
Oh,
If they
we're
had
pretty,
good,
yeah. So I can answer, but would you, either of you ladies, like the opportunity to answer first? So we're pretty early on, and so honestly, like we're in Louisville, and that's where like we're wanting to start and do a really good job at. And so I know that the company that Julie, their ED, decided to put into Longmont sounds like a great company. But to answer your question, like it just kind of worked out for the Louisville campus for us to start in.
I
yeah,
think
Just,
that another thing that we've considered, Sandy, because of COVID, really, is
Mm.
that once COVID set in, we could not have, Jordon can't go from community to community necessarily, right? So there are restrictions.
oh,
So you can't have a therapist go.
I can see that.
Yeah, yeah. So I
but
think,
yeah.
yeah.
Mhm.
So knowing that, I think it's we're a little bit gun shy yet about just having someone that takes care of all communities, unless it's the same person that goes in the building, which is helpful. And the fact that Jordon and David are based in our buildings is
Yes, I
super
can see
helpful.
that. I can
Super
see that.
helpful. Yeah.
Yeah, and
Yeah.
Sandy, I just wanted to touch a little bit on your saying that your mom had the glaucoma, because that I do low vision, occupational therapists, we do low
Yeah,
vision interventions. I mean, all the time. I'm working with a resident right now on using an iPad and those low vision features and using her Alexa device so she can increase her social participation, emailing
Wow.
her friends. She has macular degeneration. And so when people think of therapy, is very, very oftentimes they do think of physical therapy because it's very intuitive. But something like low vision, that is definitely a huge piece of therapy as well, specifically with OT, that we love to address if that's the biggest limiting factor.
yeah, yeah. Well,
Mhm.
Mom is 94.
Okay.
Oh,
So
wow.
she and her memory and her cognitive is excellent.
Oh,
You know, thank goodness, you know, that's not the reason she's there. You know, it's for physical
Mm.
and vision loss,
Mhm.
you know,
Yep.
diminished vision, just for safety.
Yeah.
You know,
Yes.
um,
And setting up her apartment, having, high contrast things for her, would be important with her low vision. And so, yeah, I mean, of course I'm going to encourage, for her to have occupational therapy to make sure
Yes.
that her low vision is being addressed. I think that would be great for your mom.
Well, and do you have a workout room in Louisville that the residents come to you, or do you go to their room?
So we do that's a really good question. We do a combination of both, and actually, we're in the middle of doing a little bit of an upgrade to the workout room, the therapy gym. But it's great to work inside the patient's room. I mean, just what you said with vision, like seeing their environment and making sure that we're taking all of that into consideration, but then also bringing them down and doing some cardio on machines and balance training with mirrors. It's a great combination of both because it really gets both worlds.
Okay, yeah. Well, mother's still in transition phase, and the therapy room, I believe, is on the second floor at Longmont, and mother won't go up there.
Is
She
it because she's scared, but a little
well,
fearful with the vision, or?
she has a little claustrophobia, and so that's not like the elevators.
Got it.
And so I was I was very lucky to get in early and get her a nice room on the first floor.
That's nice.
So that worked out great.
That is great.
But I've been thinking about, you know, getting a PT, a therapy assessment.
Yes.
Now, do you work with Medicare?
Yes.
You-
Yes.
At Louisville.
Yes.
So Medicare does cover PT and OT.
Yeah, and that was actually that study that I kind of brought up. It was a Medicare study talking about PT and OT. So yes, of course, Medicare does.
Preventive is much better, you know,
Yeah. So
anything that can prevent falls and
yeah.
strengthen the back and the legs. And mother's been having cramps too, Charlie horse cramps in the night. And I think more movement, more mobility would help that.
Yeah, and I think a lot of times families are kind of reluctant to do therapy during a transition. It's okay, it's too much. Just let them settle in for a little bit. And I kind of like to say that's the perfect time for therapy is during that transition process.
Okay.
Because when a transition is made, furniture is being decided upon, there's all these physical, like quite literal moving pieces.
Yeah.
That's the perfect time to have a therapist come in and say, oh, actually, let's have this chair because it has armrests instead of this one because this will work better, for example. It really is a good time to have a therapy eval, even if it feels a little bit overwhelming.
Yeah, I'm thinking more and more, and you've just kind of confirmed, that this has been great. Thank you so much.
You are so welcome.
Continuing to do this, even though I was the only person. I appreciate
Oh gosh, no,
all of you. I appreciate all of your time to continue because you didn't get a big response, but
no, that's okay. And
it's been very valuable for me. Thank you so much.
Oh, you're welcome.
You're so welcome. Nice meeting you, Sandy.
It was great meeting you and wonderful, great input. And yes, I'm going to think about contacting them.
Yeah.
And setting up an initial. Now, would I have to get a referral from her doctor to do the first assessment, do you think?
Yes,
Okay.
a prescription.
For Medicare
Yep.
to cover. I need to get her doctor to, okay. All
Yep.
right.
And then work with Mary Scallon, who you know, right, Sandy?
Yes.
She will figure it out and make sure that whatever is needed for your mom will happen. So.
Okay. All right. Yeah, this was just kind of reconfirmation that I should pursue it.
Yeah, you're on the right path, Sandy. That's you know, we're thrilled that you're with us tonight, because this is the first time doing something like this, and you know, God bless Judy Gold, because she's, you know, this is her wheelhouse. We're going to start with one, and we're just going to keep growing. We're just going to keep getting the word out there, and we want to keep educating our, you know, families and people. You know, people don't know what to ask, right? And
or what's offered at their community.
That's right, or what's out there. Yes, the options, the possibility.
Correct. OT, PT, you know, like, is it some like insider hashtag?
Yes.
And Sandy, next month it will be all about hospice. Not that your mom needs hospice, but it's a great education, and I'd like to invite you to that.
Oh, I definitely, you got to be prepared, you know?
Yes, ma'am.
That is true.
You never know when it's time.
Well, and there's
never ready for it.
Right. And I have learned quite recently, Sandy, that with my own mother, who I have moved into a memory care community in Southern California, hospice doesn't mean they're dying tomorrow. Hospice has, it's amazing, the range of services that are available through hospice.
Okay, well, I look forward to
that
next
Medicare
month.
picks up, and you know, those sorts of things. So we're being a little bit provocative, I suppose, when picking out some of these subjects that maybe people don't want to talk about. You know, we're going to talk about dementia. We're going to talk about, you know, therapies. Like, what do you mean there's therapies, right? Like, and you know, we're just going to keep, and hospice. Oh, the H word. Oh, is it going to? It's not. It's Judy and Jordon and everybody are all about just making sure that there's quality in life. We're not worried about quantity. We're worried about quality, right? We want to make it, they're going to, you know,
yes.
Death and taxes, right? They're a sure thing. So let's make sure that we are all informed and educated enough to make some really good choices.
That's exactly what I'm looking forward to getting more informed. Thank you so much, ladies.
Thank you, Sandy. Would you still like a copy of tonight's recording?
I don't think I need it.
Okay.
I don't know if Jordon has the handouts, your slides.
I could print them off for you and email them to you.
That would be great.
Yeah, and to be honest,
I can even mail them to you.
Well, if you have a PDF, you could send it email, and I can print it here.
And to be
honest, and I have your email, so
a lot of the information is on our website, and so if that's a little bit easier for you to just access our webpage, we can just send over our website. So
okay, like those talking points. That is on your website.
Yeah, it is.
However you want to do it, but I would like to put those in my file, you know, just for reference.
Absolutely.
Yeah, swell.
Yeah, so this is the website, and it talks about, you know, here's the dry needling, those type of things. And also what the different therapies do. So if this is easier for you, Sandy, it's just one, you know, web page that can work too. So different ways, whatever is easiest for you.
Okay, here's a $10,000 question, Jordon. How do you pronounce David's last name?
Bathalakani.
Oh,
Okay.
Yeah.
what's
Isn't
his background?
It's a
Say it again.
Bathalakani. Oh, I think I did it. Did you stop the recording before then?
No.
Is he Egyptian or
Holy smokes.
What was that, Sandy?
is he Egyptian?
Persian.
Persian. Okay.
Yeah. Yeah, that's where it comes from. So don't
That's
tell
great.
him I botched the name. So
You know what? He was not here to defend himself. So too bad.
exactly.
We're on a first name basis anyway, so we don't
Exactly,
need that.
David.
Yes,
We don't-
yes,
we know
I
David.
like it.
Okay. Well, thank you so much.
Oh, you're welcome. Thank you.
Sandy.
Have a
Have a
good
great
evening.
All right. Bye, you guys.
Bye.
Thanks. Thank you so much, Jordan.
You're welcome.
Hey, Jordan, on the when you have the prehab, who pays for like the sock helper and stuff before prehab or before you actually go to the